A newly released Department of Health survey is providing better perspective about mental health and drug use here in the United States. The results are from a nationwide study that was conducted in 2021. That year, 1 in 5 adolescents report having a major depressive episode within the last year. Nearly 22% of people 12 and older also reported using illegal drugs within that time period. To help us put these findings into a perspective that's more locally and more centralized, Sheryl Johnson with Hearts4Minds and TJ Ward with Project Opioid are joining us this morning. Good morning. Thank you both for being here. Sheryl, always good to see you, my dear. Always good to see you. TJ, let me begin with you, if I could. Would you give our viewers better perspective on this opioid crisis in Northeast Florida?
Sure. According to the CDC in 2021, right here in Northeast Florida counties, we saw 775 overdose deaths. Most of those were caused by the synthetic opioid fentanyl, primarily fake pills disguised as prescription meds that are being used by people unknowingly, containing fentanyl, and that is what's driving the overdose crisis.
Yeah, it's interesting because you and I have talked at length, in fact, about the fact that many of these are being marketed on social media and they're being marketed to young people, teenagers and young adults. That said, there is a correlation now, as we're seeing, between mental health and drug use. Could you explain that? Yeah,
mentalhealth.gov reported that 1 out of 4 people who have been diagnosed with a mental health condition also have a co-occurring substance use disorder. And if you think about it from the opposite perspective, it gets even higher. In other words, those who suffer from substance use disorder almost always have a co-occurring mental health condition.
Because so many of them turn to, medication to try to make themselves feel better. And Sheryl, you and I had a very long conversation. We cried a little bit together.
Yes, we did.
You started Hearts4Minds after your son Alex passed. Would you share Alex's story a little bit with our viewers? Because there's a real connection here between the topic.
Sure. Alex started suffering from depression and anxiety end of middle school, beginning of high school. He was a minor. We had the ability to be involved in his care, and he did really well. Graduated from high school, went off to college, had 2 really good years of school, and then started to struggle more and more with the mental health issues. And even though we brought him home and tried to help him, there were things in the mental health care ecosystem that just were making that harder. And stigmatization is one. And that's complicated. It can be family, community, it could be self-stigmatization from the sufferer, and even our provider network. Finding him adequate resources, and the underlying fear that we had was that he would, in frustration, seek out street drugs to self-medicate, even if it was just for a minute, just to feel better. And unfortunately, although we were drug testing him on a pretty regular basis to make sure we were staying on top of it, he went out and bought some prescription pills, and they were laced with synthetic fentanyl, and it took his life.
I know that that kind of struggle, and this was not a young man who was secretive about what he was going through. I mean, you and your family were extremely involved since really middle school. He reached out for help very frequently, and I know that the last time I talked to you, the struggle is you have an 18, 19, 20-year-old. They're old enough to be an adult,
right?
But the reality is they still need help from us, don't
they?
Navigating the system of getting help, which isn't always easy. Your message to parents at home who maybe are worried about their child struggling with mental health, because let's face it, boys and teenage girls are not great about talking to their parents about it.
Well, exactly.
About anything, for that matter.
Well, and true, and it can be complicated, right? The mental health journey can be complicated, and so we talk about education, early identification, and facilitation to resources. You have to listen to your gut, and you have to remind yourself that if your child is going through a mental health disorder or has been diagnosed with a mental illness, it's no different than any other disease. And if we're armed as parents with knowledge if our child has a fever for more than 3 days or falls down and hurts themselves, if it's swollen and they still can't walk on it, we know, oh, that's the point where I go to the doctor. Nobody really says to us, look, if you see that your child has gained weight rapidly or lost weight rapidly or stopped doing the things that they love or sits in their room, that those are like those things, and you need to go to the doctor, that there are things that we need help with, and it doesn't have a stigma on it. We need to just normalize it and make it and make it okay.
And talk about it.
And talk about it.
Yeah, and there are resources available, and I'm going to share with our viewers Hearts for Minds in just a second. TJ, I want to end with you just
Sure.
quickly here. It takes such a small, tiny amount of anything laced with fentanyl to kill someone.
Absolutely. Just a few, what's related to a few grains of salt even can kill somebody, 2 milligrams. So the message that we're trying to get across is do not take anything that does not come from a physician or a legitimate pharmacy, because our friends at the DEA have told us that now 6 out of 10 pills that are purchased on the street contain a lethal dose of fentanyl. So it's dangerous.
And please, I hope our viewers are hearing this and have that conversation with your children as well. Cheryl, thanks for being here. It's always great to see you. TJ, as always, we appreciate you. Hearts for Minds has a QR code that you can use to connect with Cheryl and resources in our area. You can go directly to hearts4minds.org. It'll take you there. So take your camera right now, screenshot that, scan it. It will help you right now if you feel like maybe you or someone you love is struggling. You can also learn more about Project Opioid by going to projectopioid.org. Easy to remember. We'll be right back.